Hi, I'm Dr. Carla Perna and I'm a clinical oncology consultant, and today I'm here with Gary, who's a patient I treated for prostate cancer in 2024. Hi Gary, how did it go the first time when you came to see me?
You instilled me with so much confidence. Well, Mr. Bott gave me the three options, which was the radical prostatectomy, the brachytherapy, and then the beam-targeted radiotherapy. With your expertise, I chose the beam-targeted radiotherapy.
You did decided to go for the MRI-guided machine, and I suggested that probably was the best for you due to the size of your prostate and then everything else. But do you remember what was your thought process when we discussed the side effect of the treatment?
Everything you said gave me confidence. And also, I just couldn't do the incontinence thing. That was the most important thing to me. And I don't really like the idea of being cut open, you know what I mean? And this seemed and has proved to be a better option.
You know, the two options are very similar, but they're different techniques. So one was a bit more invasive, putting some radioactive seeds inside your prostate, but done in one day. The other option that you went through, the MRI-guided treatment, was about an hour every day for 5 days over 2 weeks.
Yeah, no, that was the best one because I worked for myself. You know, I had the 10 days, didn't I? You know, where one day in, one day out, and then the whole thing's sorted, isn't it? You know what I mean? There's no extended visits or anything, is there? You know, it was brilliant.
You carried on working on the same day after?
Yeah.
How was the experience inside the machine?
It's an unusual experience. You're there in a tunnel as such, and there's a lot of noise going on around you, but you don't actually feel anything, and then you get out and walk out and you feel the same as when you went in.
So there's no pain?
No pain at all.
But I needed to also give you some bad news during that appointment, because you needed to take some hormone therapy. And that means that you needed to have hormone therapy 3 months before starting the radiotherapy, then during your 5 days of radiotherapy, and then 3 months after that.
There wasn't really any side effects as such, a lot of achiness and muscles that I didn't know I had that all of a sudden started to ache. You take, 7 tablets a week to reduce your testosterone, and then you take two to stop you becoming effeminate.
Well, what about the side effect during treatment? We talked about side effect the first time we met. So the urinary frequency and urgency, the diarrhea or potential bowel looseness, and the erectile dysfunction, was that accurate enough?
I mean, certain things don't work all the time, but you know, it's a small price to pay, isn't it?
Did it impact your relationship with your girlfriend?
No, not at all. Yeah, we just discussed it. And you were correct, you were exactly correct about orgasms being totally different. That is a new experience.
What does it mean different?
Yeah, it's just less intense.
Alongside of the radiotherapy, there are many options and support that can be done in Genesis Care. What did you choose?
I chose the exercise medicine. So I did really enjoy it. The girls give you a set routine, you know, which they vary every 2 weeks or something, which, yeah, and it's all targeted to wherever the muscles need strengthening, which was great, you know, really enjoyed it.
I'm interested to know, looking at yourself back into the Gary from last year, was there anything that you would have done differently, or?
If I had to make the decision again, I'd do exactly the same thing, without a shadow of a doubt. Yeah, I'd recommend anyone having the MR Linac. To know that it's sorted is a great relief, isn't it? You know what I mean? And you're just happy to be free of it, I suppose, and yeah, just get on with life, you know.
Thank you so much, Gary, to be honest today and sharing your experience. And it is extremely important to be honest with the doctor, with yourself, and make sure that you do know what the side effect potentially can be for your treatment, and make an informed choice, because that is the importance. So going back to your life before the treatment and before the cancer. So thank you, and thank you so much, Gary.
No, thank you.